Hello everyone, my name is Allison Waters and I am delighted to present to you today during Innovation Week. I hope you have been enjoying all of what the programme has had to offer so far. So today I am so happy to be able to tell you that our new Health Professionals website has been launched. I think this is really appropriate that this is being done and launched during Innovation Week because this really has been a team effort across the whole organisation and is offering us something new, different and added for all of us working here at IBTS. So why do we think that this was needed? Well, there really needs to be a way to engage directly with all our professional colleagues that are working in all the areas allied with blood transfusion, hematology, blood donation. We wanted to be able to provide detailed clinical information for our professional colleagues, a really nice and new space to showcase our research. So there's been such a renewed focus and interest on research and development, but we needed a way to tell everybody what we're doing, what we're working on, what are our publications, and where are we going in the future. And tied in with this and the same audience is really important for us to develop our profile as educators. What education are we offering here at IBTS? Who are we routinely training? Who is coming in? Do people know this? So that we can give them all of the information and all the various lectures and journal clubs and events that are happening all the time. All of these together really show us as leaders in this area. And I think this is something that's been a key strategic initiative, is to pull together all of our strengths professionally and showcase those out into the world and put ourselves out there as leaders in blood transfusion. And this provides us also with a way to communicate to all of those professional colleagues and collaborators that we have, that we work with every day. And I think altogether then, this is part of the supporting better healthcare pillar of our Connections That Count strategy. So who are the target audience? Well, it's scientists, medical doctors, nurses, researchers, public health specialists, really anybody that is working in a field that can be in some way at some point allied with donation, transfusion and hematology. Broadening this out to, epidemiology, diagnostics, component development, everything you can think of. And who is that? Well, I think altogether that's hopefully all of you that is listening. So this is a website that not only we want to link with all of our professional colleagues, but also a way to really directly communicate with you, because all of you are the professionals that are working in this area. And this is to really showcase the work that you do every day. So what is the website going to show us? Well, it's been divided into three sections, and the first is clinical services. Some of you may already be familiar with this on our current website, giveblood.ie. This has all been migrated over, all the information there, and I suppose has been given a bit of a new look and feel. So you can see here, we've kind of categorized everything all the way from your finger prick when you go in to give your donation, through to making the components and getting ready for your transfusion, what kind of clinical support is there for you, how do we monitor quality and ensure that from a hemovigilance point of view that everything is going okay, who's working here, what careers are being offered, and lastly then, are you looking to donate? If you're somebody who's reading this, maybe we want to recruit those as well. So everything has been kind of pulled together in these sections. We have a new one, which is on the National Donor Screening Laboratory, which covers infectious serology and NAT testing and automated donor grouping. And we have a special kind of page then on the Green Labs Guide and that initiative that has been so successful this year. Then we move on to blood components and hospital services. A lot of this is the same content that's been migrated over, but you will see that we have kind of updated it somewhat, and directly available here are all the components that we produce. So it's a really kind of good place for somebody who's coming in who says, what products do IBTS make? They look here, they can go find them there, and it should be very easy accessible for them. We move on to transfusion and transplantation and all the various laboratories that contribute to the really critical necessary testing of either the donors and the recipients and the patients. So that covers the NHIRL, blood group genetics, RCI, and as well as many of our other services. Moving into clinical support and guidance, we have a page here telling you how to access our consultants that are on call, as well as some of the surveillance programs that we're involved in. We have a page that's been migrated over very specifically on reporting to the National Haemovigilance Office, and then moving into a section on laboratory quality and compliance, which of course is key to everything that we do. It is kind of interwoven into so many of our processes. We have now added a link to our careers portal, as well as a link out to the Give Blood page for eligibility to donation, so that once we've captured somebody here at the website, maybe we can also recruit a new donor. The next section that's there, I suppose, is one that I have been overseeing alongside Grace Cassidy, who's done so much work on this. And this is the whole new section on research. We go through, describing our research strategy, the various research projects that everyone is working on. That includes all the different research themes and our most recent publications. I would envisage that this is an area that we will keep regularly updating as we get new publications out all the time. A lovely page showcasing all the various researchers. And this has been, a lot of people already have a lot of publications out there, and it's to really kind of give them a profile to the outside world as to their area of specialty. We have a new link here for all of the researchers external to the